Are you curious about which grade your receding hairline or the visible balding area in the crown region at the back of your head has reached? Doctors often write down the grade of baldness once they have diagnosed a patient with androgenetic alopecia. Let me help you understand your grade of baldness in a better way. The importance of knowing the classification of baldness is to give an idea about the future balding pattern in a patient to avoid an unpleasant looking hair transplant result, say 5 to 10 years after the hair transplant. It also helps to find out the number of grafts that would be required during a hair transplant procedure. There are two main classification systems used to classify male pattern baldness. The first one is the Hamilton classification system. The second one is the Norwood classification system. The Norwood classification system is most commonly used worldwide. According to Norwood, there are 7 grades of male pattern baldness. Let me emphasize that there are a few patients who fall exactly into one of these categories. But on the other hand, there are many patients who might be hybrids of a combination of these categories. So let's begin with talking about type 1 male pattern baldness. In type 1 male pattern baldness, there is minimal recession of the anterior border of the hairline. Many normal men in their 20s fall under this category. In type 2 male pattern baldness, there are temporal areas of recession on both sides of the head, and these areas of recession lie in front of an imaginary line drawn to join the ear openings on each side of the head. This imaginary line forms a vertical coronal plane. A type 2 male pattern baldness might look normal on a 47-year-old, but it might greatly distress a 22-year-old. Patients with both type 1 and type 2 male pattern baldness are not ideal candidates for a hair transplant since they have not yet achieved a stable pattern of baldness and are usually below the age of 25. In type 3 male pattern baldness, the areas of recession in the temporal regions extend more deeply or posteriorly. These areas of recession lie behind the imaginary line drawn to join both the ears on each side of the head that forms a vertical coronal plane. There might be some frontal recession of the hairline as well, but this is not very obvious. Patients of type 3 male pattern baldness may be in their 20s, 30s or even 40s, and they commonly get their hair transplant procedure done as their ideal candidates. There is a unique form of baldness known as type 3 vertex or type 3V male pattern baldness. In these patients, there is a round or oval region of balding at the back of the head in the crown region. There may be some frontal or temporal recession of the hairline as well, but this does not exceed the recession which is seen in type 3 male pattern baldness. This kind of baldness is common in aging men, but in some patients it might occur early and it usually precedes the frontal hair loss. In type 4 male pattern baldness, the frontal and the temporal regions of recession are more obvious than the recession found in type 3 male pattern baldness. Also, there is an obvious area of sparsely covered crown region or a balding crown region at the back of the head. These areas of baldness are extensive, but they are clearly separated by a bridge of moderately thick hair which joins the thick hair fringe on either side of the head. It is important to not confuse type 3 vertex with type 4 male pattern baldness. In type 3 vertex male pattern baldness, there is primarily loss of hair only in the crown region and it precedes the frontal recession. Let's move on to type 5 male pattern baldness. The three zones of baldness in this pattern, which are the two temporal regions, the frontal recession and the crown regions, have almost joined, but there is still a separation between the frontal and the crown regions by a bridge of thin fine hair which joins the fringe lying on the sides of the head. The frontal forelock is now just a small island in the front, as you can see. In type 6 male pattern baldness, the bridge of hair that separated the frontal and the crown regions of baldness has now disappeared, and the frontal and the crown regions of baldness now look adjoined or confluent. Also, the thinning of hair or baldness has exceeded on both sides of the head and also in the occipital region lying on the nape of the neck. This results in a horseshoe-shaped zone of persisting hair. The anterior hairline has also receded considerably as well. In type 7 male pattern baldness, or the advanced stage of male pattern baldness, there is only a narrow band of hair consisting of very fine hair that exists. This band starts just in front of each ear on both sides of the head, continues backwards and ends quite low in the occipital area on the nape of the neck. Patients with type 7 male pattern baldness are not ideal candidates for FUE or follicular unit extraction method of hair transplant, as they do not have enough density in the donor area from where grafts are harvested. This makes it very difficult to harvest grafts which would be enough to cover the area of baldness on top of the head. After discussing the various grades of male pattern baldness, let's move on to female pattern baldness. Women generally do not lose their anterior border of the hairline. There is incomplete coronal hair loss which occurs in a diffused fashion in the frontal, the central and the crown regions. Ludwig has classified this diffuse thinning of hair into three types. Type 1 is the mild form. Here you can see the mild form where there is no specific demarcation of any area of hair loss. Type 2 female pattern baldness is the moderate type of female pattern baldness, where again you cannot see any specific demarcated area of hair loss. Some women develop a Christmas tree pattern of hair loss along the middle area. This might cause a breach in the frontal hairline occasionally. If this video helped you in understanding your grade of baldness, please like this video. I would be happy to answer every question in the comment section below. Have a nice day. Thank you.